Welcome to the Beauty Box Show. I'm your host, Milan J. Today we have a special guest, Patrice Breggs. Now, she is the owner of, did I say it right? I want to make sure, because you know I was, listen.
That's perfect.
I don't want to mess her name up. But she is the proud owner of the Floss family Dentistry.
Yes. Perfect.
Now, and she's also my dentist. Now, I just really wanted to bring you onto the show because the Beauty Box is more than just talking about makeup and hair. We are covering all grounds in reference to everything that's beauty. Now, our smile is everything. And this is why I felt it was so important to bring her to the show. And I'm going to let her introduce herself and tell your story, okay. And then we're going to talk about what we're going to talk about. I'm excited. All right. Come on now, tell me. I'm ready.
Thank you so much for having me here in the Beauty Box. I'm ecstatic about being here because I'm talking about one of my passions, of course, and that passion is dentistry.
Okay.
I'll tell you a little bit about my background. I'm from Hampton, Virginia. I went to Howard University College of Dentistry, and of course, you know, there's that ongoing feud, which one is the real HU? I don't have a dog in that fight because, of course, I have a little bit of Hampton and Howard. But I am a proud graduate of the College of Dentistry at Howard University, and I graduated about 20 years ago.
Oh, I didn't know that.
Mm-hmm.
So you got a little skin in the game.
A little bit. We're going to call it experience. So I also am the proud owner, as Milan said, of Floss Family Dentistry, and I've been at that location for about 10 years.
Now, okay, so see, this is another thing that I want to bring light to, because we can be owners, but you're also the owner of your space.
Right.
You own your own brick and mortar. So,
yes,
so we got to acknowledge that. You know,
Thank
we all can get into that space, but I'm proud of that.
Yes.
I'm working to be like you, girl.
Okay.
So yes, okay, and you're in Clinton, Maryland.
Yes, I'm in Clinton, Maryland.
And then so now you've been doing this for like 20 years.
Mm-hmm.
Now you and I had a conversation, and what has been really moving for you is the teeth whitening.
Right. Let's get into teeth whitening. So we're a family-based dental office, but of course with the summer months coming up, people are
Summer months.
Oh, with the summer months coming up, people are always wanting to do cosmetic things such as bridges, veneers, crowns, and stuff like that. But of course, the big buzzword is tooth whitening. And we have pretty much specialized in teeth whitening. So I think we have a corner on that. And we have some amazing results. People come from as far as Pennsylvania to get their teeth whitened at our office, and we love all our patients.
Yes, and this is her work, guys.
And she
this
is
her work.
Also one.
Now, also too, now on average, so how often someone should get their teeth whitened?
I would say no more than once a year. You get your teeth whitened about once a year, and then of course you can come for maintenance, like a scheduled maintenance visits. And they're about the same. However, once you get that initial whitening, it doesn't go much further than that. So based on the first whitening, you go up about 8 shades from your original shade. And then with the maintenance, you may go up another 1 or 2.
Oh wow! Mm-hmm. So, and then I know I'm a coffee drinker.
Right.
So being a coffee drinker, how frequent well, I guess that depends. So if someone is a coffee drinker or someone eats a lot of curry, curry can stain your teeth, right? So the diet has a lot to do with possible results. Do a person can get their hair, I'm talking about hair now. Can a person get their teeth whitened more because of that?
What I recommend for people that drink not only curry, you're also people that drink a lot of coffee, tea, And also, a lot of people don't know red wine. Red wine also stains your teeth.
Wow. Ladies,
right.
ladies, I know y'all love your wine, but she's about to tell us how to continue drinking the wine.
And you're not going to believe this one. If you drink through a straw, now they have glass straws that you can enjoy your beverages with that maintain your whitening.
Oh, wow. So the glass straws.
Glass straws, metal straws.
So which one you prefer? Would you say?
Either, it doesn't matter. People are moving away from
the metal.
The metal straws, and of course paper wouldn't work in this instance, but metal straws, glass straws, and I understand Beyonce uses glass straws to protect her whitening as well.
Oh, you know, okay, Beyonce uses it.
Yeah.
But so the Beehive's like, yes. So let me ask you this. I guess I sound so aggressive, like, let me ask you this, because I'm like trying to get questions for myself. But with the teeth whitening and the frequency, based on diet and all, when is it a case where you shouldn't get teeth whitening?
Okay, so a lot of people kind of shy away from whitenings because before there was a greater or an increased rate of sensitivity with whitenings. It's been perfected. It's been perfected. It's not, you don't have that really high degree of sensitivity like you did before. The new kits, they also have a post-operative sensitivity kit that you could use if you are a person that has sensitive teeth.
Okay.
So that's one of the advancements with whitening. And also they also give you a measurement in order to protect the soft tissue when you get in. I see some great examples of some whitenings that you can see behind us now. You can see on this particular picture that her teeth probably have gone up 6 to 8 shades.
Yeah, definitely.
That's amazing. But what I was saying now, the new whitening kits, they protect your soft tissue and your hard tissue. So they protect your gums and your teeth from the sensitivity that it used to cause. So more people are willing to try now.
Yeah, and I honestly, I know for a fact that when I were doing it myself at home, not only was I didn't know what I was doing, I kept getting all of this like little white stuff on my gums.
Right.
And then when you said, girl, you were burning your gums. So I was like, oh, wow. Like, so someone who's whitening their teeth at home more frequently than saying trying to save, are they doing themselves any disjustice or harm?
Yes, you are. So what I would say is whenever you whiten your teeth, you want to go to a licensed dental professional. And I'm so glad you asked me that, because there have been so many people on social media, Instagram in particular, that claim they are teeth whitening specialists. If you don't have a degree in dentistry, I would highly recommend that you stay away from teeth whitening. I would say in order of effectiveness, the first level of whitening would be like, for instance, the white strips, Crest white strips, something like that. The second level would be the trays. And that's something that your dentist will make a mold of your teeth.
Gotcha.
And then we would send you home with those trays. And then, of course, the platinum of them all is the chair side whitening that we do for you, where we apply everything from beginning to end. That is hands down the way to get the absolute best results when it comes to teeth whitening.
Okay, so now we tend to live in this society where there's a lot of scammers, right? So, and you said that someone should have a degree.
Right.
People could cut and paste and do all type of stuff. Would it be a situation where only you have to have a specific certification to order certain products, or?
The only people that have access to the level that high percentage whitening products are dental professionals.
Okay, so keep that in mind, folks. It's those folks that can get what you're supposed to get, and if they can't, then you're not going to the professionals.
And just look at the results. You can see for yourself based on some of the pictures that we had.
Well, we're gonna actually go over more of the pictures. So we're about to take a quick break. We'll be right back, and when we come back, not only are we going to cover a little bit more details. I know we had saw some of the pictures, but we're going to look at them again, and we're going to give a little bit more details on them. So I know we kind of flashed them a little bit, so you guys can see the drastic difference. But stay tuned. We'll be back, and then we got more for you.
Did you know dragging chains can spark a wildfire?
Only you can prevent wildfires.
Welcome back to the Beauty Box Show. I'm your girl, Milan J, and I again have Miss Patrice Breggs. Did I say that again?
Yes,
you know,
you
I'm going to
did.
keep saying it. So I'm used to just calling her by her first name. But I wanted to really ask you, what made you get in the industry?
Well, actually, I started out wanting to be a veterinarian. So I have a degree in animal science.
What?
And I went to 3 HBCUs. I started out at Virginia State University in Petersburg, Virginia. Then I transferred to University of Maryland, Eastern Shore.
Okay.
And that's where I finished up my degree in animal science. So I was actually accepted to Tuskegee University School of Veterinary Medicine. But I decided to do an internship over the summer, and I realized I'm terribly fearful of cats, so that wasn't going to work out. So I decided I wanted to do something with my hands. I didn't want to be in the hospital, so I said dentistry. And I'm so glad I made that decision. I am just as passionate about dentistry now as I was when I first graduated.
Wow, well that's you know what, that's how it is. So
Yep.
sometimes it goes that route.
Yep.
So also too, that's I'm still laughing at the.
Scared to death of cats.
Oh, you figured that after how long you invested into school, okay? But that's the same thing. I wound up doing hair, and I was in fashion. So I went to fashion high school.
Oh, wow.
And I wound up
didn't know
learning
that
how to
about
do
you.
hair in a 9th floor bathroom.
Wow.
Right, so it takes a turn, but this is what we're destined to do. Now, also too, what about the community? Do you do stuff around the community for the community?
Yes, actually, I started in public health.
Okay.
My first job coming out of dental school, I worked at community-based dentistry in Washington, D.C.
Okay.
And so I'm passionate about giving back to the community. I go to some of the area elementary schools, and I speak at the health fairs and stuff like
nice.
that. And I also give them an opportunity to come to the office and shadow me if they want.
Oh, that's
So,
really nice. That's really a great thing. You know, because a lot of times we get caught up in our world, and it becomes work, and then we just work and go home, and we
Right.
do forget to put back and
Right.
give back. So that's nice to know. I mean, I've been doing your hair for so long that
Right.
you know, having a conversation with you and finding all of this stuff out, like, wow, I'm like, you know, we don't talk much.
Right.
We just talk about whatever and whatever our hair issues and concerns and how I can fix it, but we don't talk.
Right. So
know?
for the past 5 years, we've been involved in like a special little project. I've gone to some of the high schools and donated prom dresses to several other women.
Oh, wow. Did you do that this year?
Yes, we did.
Oh, like we was, you know, I had a guest and we were speaking about prom and Ron Cook, and this is just amazing. This is like perfect time, and I know they really are grateful for that.
Right, they are.
And so do you do a drive for the dresses or what?
No, I actually just purchased the dresses.
Oh,
We get
wow.
about 4 or 5 each year, and the dresses actually go to some of our patients.
Oh, that's
So.
see, that's nice. Giving back to
Right.
That is really, really nice. Wow, you know, I'm kind of like, you know, just like wow. I'm like really wow, because it's like, dang, I've known you for this time, and you're
Right.
doing all these amazing things. We're so low key.
And we have patients, they come from all walks of life. I have politicians, I have celebrities, I have farmers. So you meet so many amazing people, and in meeting these people, you get to know their stories and their background, and you just want to get closer to them. So you decide to do things for the community. And in seeing these patients, I also have educators. They've invited me to come out to the health fairs in the schools where they may work, and that's when I go and speak to the children.
Well, good for you.
And then, of course, I have college students that may be interested in a career in dentistry, and I allow them to come back and shadow me before they make up their mind like I did and made a horrible mistake and wasted my mother's money. So to prevent that from happening, I let them come and shadow me.
Well, no, you know what? That's really good. So you are giving back in so many different ways, and I commend you for that.
Thank you.
You know,
and I'm so glad
like,
I chose dentistry as a career.
Well, I'm glad you did too, because you keep up my teeth. Well, guys, we'll be back. Stay tuned.
Don't wait. Communicate. Make your emergency plan today.
Welcome back to the Beauty Box Show. I'm your host, Milan J. And again, we were talking about Floss Family Dentistry. And we have Miss Patrice Breggs.
Yes.
I did it right?
Right.
Okay,
you
so
got it.
I really want to revisit the pictures because she really want to get more into details as to what the teeth is doing and what the whitening has done and so on. So we didn't want to just brush past. I want you guys to really get to look at the difference and see how drastic she made an amazing result for each one. So we're actually going to pull the pictures up now. So let's go into little details for me with this, because this is real drastic.
Okay, so you start, the earliest I generally like to do whitening on patients is about 16 years old. And of course from 16 you can go as long as you have teeth from there. So the youngest is about 16 years old, and we get a lot of whitenings around prom season. And this is one of my teenage students, of course, and she wanted her teeth whitened for prom. Her teeth, she eats a lot of curry, she drinks a lot of coffee and a lot of tea, so she had quite a bit of heavier staining. However, that shows you just how good some of the whitening systems can be, because you can see the drastic difference that the whitening has done for her. It's taken her teeth up about 8 shades.
Wow. First of all, 16, coffee.
Well, we have them going to Starbucks around 8 and 9 years old. So,
that's
I mean,
amazing.
it happens.
I mean, when you look at it, like looking at what it's doing.
Right.
So now, that's, like I said, this one here, that's the young lady who had the different shades. Now, I'm not sure if we have another picture that we'll go across, but they're okay, great.
And here we have someone, their teeth, that's about actually, most people have that natural color. The top picture is the natural color of average person's teeth. So as you can see, her teeth went up about 6 shades, and she was absolutely impressed with the result, as were I. The whitening system does very well.
Okay, and then the next one, I believe we did. Now that's amazing.
And here, yes, I have a patient here. She's prepping for a bridge to fill in the spaces at the top and the bottom.
Okay.
So prior to matching your teeth for the bridge, she wanted a whiter look. So before we could do a bridge, we had to whiten her teeth. So.
Oh wow, that's nice. Yeah, because I guess you wouldn't want to have existing color and then match the bridge to that color.
Right.
Or
you got it.
or have a stripe. Okay, so I'm not sure we have any more coming up, but there it is. Yes.
And here, and as you can see, This patient, their teeth weren't that yellow as well, but she got a fantastic result at the bottom.
Absolutely.
We do protect the white tissue at the top. You can see how we have gauze and all of that good stuff that you can't get at home if you go to someone that's not a dental professional. And you can see even at the bottom, even I caused a little bit of a burn. The whitening actually utilizes a special bleaching agent, which is mainly based of peroxide. And the patient sits under a blue LED lamp for about 45 minutes to an hour, and that's how the whitening is achieved.
Right. Now, also, too, these sessions, I remember when I got mine, they were in segments.
Right, 15-minute segments.
Right, and it went by pretty fast.
Yep.
It went by pretty
wear your
fast.
headphones, listen to the music you want to listen
Right.
to. You can listen to the television. It's totally up to you. But we definitely offer a relaxing atmosphere.
Yes.
That you can come to and get your teeth whitened.
Absolutely. It was for me. Now, this one here, same thing, huh?
Right. Same thing. This patient was getting ready to celebrate a birthday.
Okay.
And they wanted their teeth whitened, so this was their gift to themselves.
Same thing.
Yep, same thing. You can just see yep, same thing here.
That's a very nice thing.
And then, of course,
That's my mouth. That is me.
right. And that picture was actually maintenance. Milan had already had a whitening once, so her teeth had already gone up quite a few shades. But as you can see, for the last picture, it went up even one or two more.
Now, you know, as I'm looking at the picture, and I'm seeing my teeth are actually whiter than it is in the picture.
Right, right.
So, and I'm like, wait a minute, is it getting whiter over time? But, you know, but I guess just the way the picture was from your lighting,
Right.
and I'm looking at them like, yeah, my teeth is like that. Because people are like, oh, your teeth
They
are so
look
nice.
really
And I always
good.
say, oh, you know, I get them whitened. But again, I just think this is such a necessity. You know, a lot of people just don't really invest into their mouth.
Right.
You know, your smile is worth $1 million. You know, but again, not a lot of people are in position to do it. You know, in general, well, because we can't discuss numbers,
Right.
but I guess does any of this is like covered under any type of insurance?
No,
'Cause
so
it's-
unfortunately, whitening is considered a cosmetic portion of dentistry,
Got
so
you.
none of it's covered by insurance at all.
Got you. Okay. Now, also too, if someone has any type of dental work besides a bridge, like a root canal, or maybe some form of
Like
disorder.
a crown. Well, the only thing that's going to change in color when it comes to whitening is natural tooth structure.
Okay.
So the only thing that it will change is the enamel.
Okay.
And the interesting thing about whitening is your teeth are whitened from the inside out.
Nice.
Yeah, so that's exactly when you get the professional whitening, that's what happens.
So if it's not professional, it's exterior.
You're not gonna, right, it's exterior, and the professional whitening is intrinsic. It happens from the inside out, and you're not gonna get that from the white strips. It's just gonna be
Gotcha.
very superficial,
Now, also too,
and it's not gonna last as long.
would it be a situation where if someone has like any type of gum disorder, can they get whitening as well?
Well, generally, before you get a whitening, you're going to have a full exam, a comprehensive exam. And when we do a comprehensive exam, we check for the health of your gums, we check for the health of your teeth. Typically, when you get a whitening done, you shouldn't have any cavities. You should have had all your dental work done prior to getting one.
Okay.
Yeah.
So I know you've had people come in, their mouth is ready to go
Right,
into a whole different direction. They're like, I
mean,
just
and
want the
first thing,
whitening.
That's all they want. We get that more often than not, sadly, but we get them to where they need to go because we're all-encompassing dental office. We're comprehensive. We do it all. We do the extractions, we do the cleaning, we treat the periodontal disease, we do the crowns, we do the bridges. Everything is there. Root canals, simple root canals, we do that as well. So we get you to where you need to go. I think the beauty aspect of it is secondary. If you had to ask me, the best thing about dentistry is prevention. You want to have a good dental visit when you come. You don't want to have to get an injection every time you come to the dental office. If you focus on prevention, then you don't have to worry about those scary appointments and stuff like that where you were traumatized as a child and people are holding you down for you to complete your dental work.
Yeah, because a lot of people hate the dentist.
Anymore. Yeah, and it's just because of those experiences.
Yeah, I mean, you know.
But we take scaredy cats too now. So if you're afraid to come to the dentist, you're at the right place. We take everybody from the toddler all the way up to grandma. So.
Well, yeah, and like I said, your office is it's very friendly.
Right.
And it's intimate.
Right.
You know, it's not that it's small. It's just intimate. You know, so I do think that having a great setup where it doesn't feel so sterile or so commercialized, it does make the experience in general, you know, better. Now, you kind of almost went into a tip of the day, that little tip that you had, but maybe you have another tip. You don't have to spoil, but look, if you got something else that you probably can advise, that would be great. If not, you know, because like I said, you're giving such great tips on that, but you let me know. You got something, I would love tip of the day for you to share that.
Well, to piggyback on that, definitely you want to focus on the health of your mouth before you get into a whitening, for sure. But prevention, prevention, prevention.
Now,
that's the most important thing.
What's the
about
key thing
dentistry.
to prevent?
Come visit your dentist every 6 months. Before anything can happen, we're right on it.
Now you wait. That's one thing you would tell me. Milan, floss. Don't forget, because you know we be trying to run. You
and
definitely.
That is Floss Family Dentistry. So make sure
I was
you
just say floss. She says it so much. Listen, I've changed my game since you told me to floss.
Good.
And it does make a difference. And it also takes away the bad breath and stuff like that.
It does.
I used to think it was from my tongue.
Because until you start flossing, you don't see all the food particles that get stuck in between your gums and stuff like that. I think some people refer to it as second meal. By the time you finish flossing all that stuff out, sometimes you have enough food in there for a second meal.
Yeah, I remember one time I did it, and it was just like, I was like, ooh, I didn't even know that piece was there. You know, but I get it. But I haven't had, you know, like I said, little things. But I appreciate having you here.
Thank you so much. I can't wait to come back.
Yeah, listen, you will, because I definitely gonna come back and see you too.
Right.
I know I'm only supposed to come. I might need a maintenance.
Gotcha.
But overall, where can they find you?
On any social media platform, just search Floss Family Dentistry, and Clinton, Maryland will pop right up.
Well, again, thank you.
Thank you for having me.
All right, guys. Well, we're gone. I appreciate you. See you next time.